Welcome back. Now, we've had many great discussions today here at the Second Conclave of the ABLF Talks, and we're delighted that you're still with us and so many more people joining us from around the world. It's really great to be with you. And indeed, we look forward to many of your questions. We've had some great questions in from people, so continue to do that, and we will make sure we get as many as we can to our guests. Now, I'm very, very excited about this panel, and I think it's absolutely very important, without a doubt. We're looking at healthcare systems around the world, and really this is a time when health is at the top of everybody's agenda, and it's not just a government concern, it's a personal concern, it's a professional concern. It's something we all really need to be looking very carefully at, and of course the pandemic has made sure that it has moved to the absolute top of the agenda. I'm joined now by a lady for a conversation who is a pediatrician from India, and she's globally recognized researcher in tuberculosis and HIV. She has more than 30 years experience in clinical care and research, and she has worked throughout her career really translating research into practical programs. She has worked as a coordinator for UNICEF, for UNDP, the World Bank, and for the World Health Organization's special program for research and training in tropical diseases in Geneva. And she is, of course, with the World Health Organization. She is the chief scientist. She's currently in Geneva. And I'm absolutely delighted now and very, very honored to have with us Dr. Soumya Swaminathan. So I want to welcome Dr. Soumya to this ABLF. Thank you so much for taking the time to join us.
Very much, Etna. It's a pleasure to be with you at this forum, and greetings to all the listeners and participants.
We can only imagine how busy you all are at the World Health Organization right now. So again, thanks for being with us. But bring us up to date in terms of, what's happening with regards to vaccine. The world is waiting for availability, for the implementation, and really for the accessibility worldwide. What can you tell us right now?
Etna, as you rightly say, this is something everybody is interested in and want to know, because obviously the pandemic has placed us all in a really difficult situation. So the first thing I'd like to say is that there's room for a lot of hope. There is light at the end of the tunnel, and we are going to come through this. But we need to do a few things to get there. In terms of vaccines, we have a really very robust portfolio of vaccine candidates. This is unprecedented. I mean, never before in the history of any disease have we had 200 vaccine candidates that have, been developed within a matter of a few months, and over 40 of them now in clinical trials, 10 of them in late stage clinical trials, what we call phase 3 trials. These are the trials that are done in tens of thousands of people, and that establish whether a vaccine is efficacious. Does it really protect against the infection? And it also tells us about safety. Now, this is very important, because this vaccine or vaccines are going to be given to billions of people. We are normally used to vaccinating in the tens of millions, because most vaccines go to children, and at the most in hundreds of millions. So the scope of this whole thing, the production of vaccines in the billions of doses, and the distribution of vaccines, and the deployment to people all over in every country in the world, is on a scale that's never been imagined or done before. Now, of course, this, even though the people are working, scientists and companies and everyone concerned is working at full speed, it still needs to go through these phases, right? You don't get vaccines into people without knowing if they're safe and efficacious. So even though it's the shortest possible time, it still takes 12 to 18 months is what we are hoping. So we started vaccine development. Many companies started in January as soon as they heard about the new virus and they saw the genetic sequences of the virus that were shared by Chinese scientists on January 10th. That's when vaccine development started. And today we're, even before the end of the year, we're close to getting results readout from a few trials. What we've also done is work with many of our global partners. So WHO initiated something called the Access to COVID Technologies Accelerator. This was started in April with many countries, with global health agencies like Gavi, like CEPI, like UNITAID, foundations like the Gates Foundation and Wellcome Trust, and many other partners, to not only accelerate R&D, but to ensure equitable access, because we don't want to be in a situation as we've been in the past with many diseases where there are huge delays, sometimes up to decades, between vaccines being available in high-income countries and being available in the rest of the world. So we don't want that situation, because the pandemic will not come to an end unless people everywhere are protected. So the idea really is set up a pool mechanism where you pool risk. So we've diversified investment in many different candidates through CEPI, which is the Coalition for Epidemic Preparedness and Innovation. So we have currently 10 vaccine candidates that have been supported through this mechanism. And we have the COVAX facility, which currently we have 186 countries representing 90% of the world's population. So it's been a tremendous success story so far, at least in terms of the world actually wanting to work on this together. So the COVAX facility would be the one that actually procures a vaccine, hopefully at the best possible price, at the most competitive price, and then distributes it around the world, both to self-financing countries, which are going to pay for the vaccine doses, as well as to 92 countries that constitute countries which are low and middle income, which will get the vaccine either free or at a very, very subsidized rate, so that they can also start vaccinating the populations. And I'd like to add that the consensus now is, and this is again work led by the WHO, is that the most high risk and vulnerable people in all countries should be vaccinated at the same time, which means healthcare workers, frontline workers, and then the high risk elderly, the other vulnerable groups. So it's for we've put out the principles, but every country will decide, which groups they're going to target and how they're going to proceed. But we want that to happen simultaneously in all countries, because without health workers.
And unfortunately, we have a little technical problem there, but we're going to start it again in a minute. Just this does tend to happen, so we really apologize about this, but fascinating conversation there, as she talks about what is going on in the world and what's happening with regards the vaccines that are in place. I mean, really, really looking at all of the work that has been done, the urgency that's in place, and how quickly people are working towards getting that 200 vaccine candidates, as she said there, also 40 clinical trials, and again, the COVAX facility, the work that they will do. And I think one thing that she made very, very clear there was, the importance of making sure that the most vulnerable in society are going to get access to this very, very quickly. And also, of course, frontline workers, number one focus there, because they are very much the people who are keeping us all safe. Let me check in just to see now if we have her back. And I know the technology gives us a few challenges every now and then. Dr. Soumya, have you managed to get back in?
I can hear you and see you perfectly. Can you not hear me?
Sorry about that. We had a little bit of a technical glitch there, but and let me just carry on from what you're saying there, because such vital information as you were letting us know there. But and great to hear so much is going on. But as you said, yes, this does not happen overnight. You've got to make sure that everything is safe and that it's effective, and that when you're distributing this vaccine, that it goes to who needs it. But there is, without a doubt, a great sense of urgency at the moment. And you were talking about, that distribution from the COVAX facility to make sure that particularly poorer countries, and people who really cannot afford that are going to be able to get this as well, because ultimately it has to go out, I guess, at the one time worldwide. So huge demands on the work that you're all doing right now.
And I want to emphasize that it's not just the poor countries. It's a mechanism that is a win-win for all countries. Because if individual countries start making individual deals with companies, there is no guarantee that that particular vaccine is going to be the most effective or the safest or the most affordable. And so it's much better to invest in a mechanism that serves everyone. There are so many advantages, including getting things at the best price, but also being able to select the best candidates from the portfolio. So it's really the enlightened self-interest of all countries to work on this together in solidarity. The other thing being that trade and business and the global economy cannot reopen if you have a few countries that are protected and the rest of the world is still exposed. So for the global economy to restart, you need to ensure that you bring an end to the acute phase of the pandemic, which means covering every country with the highest risk group. The one other point I'd like to make is that the vaccine rollout is going to happen in phases. It's going to take time. As I mentioned, you're not going to have, 7 billion or 10 billion doses of the vaccine available at the beginning of next year. It's going to come in phases as manufacturers ramp up production. So people need to understand that they still need to comply with the measures that we know work today, the distancing, the masking, the hand washing, the avoiding crowded places, making sure that there's good ventilation in indoor spaces. All of these are going to be needed for the foreseeable future, till we get to the point where there's enough population level immunity that's been built up through the vaccination programs. But that's going to take 12 to 18 to 24 months. So I think we need to also temper expectations and not expect that everything will be back to normal, next year. It's a difficult message, but it's best to be prepared for that. And I think it can be very helpful if people and governments are prepared to continue with these existing measures while vaccines also start getting rolled out.
So right, and that's so important. And I think if people have learned anything, it's all of the better health practices, the better individual practices, and ultimately I think it probably makes good common sense, so people will be better off. And of course, this pandemic really caught the world by surprise, but also really exposed a lot of frailties in the healthcare system in developed countries and indeed in developing countries. What are the main lessons, would you say, that we have learned?
Yes, I think we've learned several lessons, and I hope that we learn them in a way that we build back better or build forward better, as some people like to say. Because it's not that we didn't know that there would be a pandemic. There have been many, many groups that have raised this as a very realistic possibility, including the Global Preparedness Monitoring Board that was set up last year by WHO and by the World Bank jointly. That panel actually produced a report in October last year, which warned the world that a pandemic due to a respiratory virus, could happen anytime, and that the world was not prepared. And sure enough, I think the lessons to be learned are that investments in public health system and primary health care, to me, that's the biggest message. Countries that have invested in primary health care, even those countries which are low income countries, which do not have sophisticated tertiary hospitals, which do not have intensive care beds. I was listening to the minister from Sierra Leone speak last week. We've heard presentations from Vietnam, from Rwanda. They've just been able to do the very basic things, the public health measures, of course, setting up the diagnostic testing rapidly, but then making sure that there's contact tracing, there's quarantining, there's community engagement, that there's good communication to people so that people comply. And of course, they had to expand oxygen capacity. Many countries didn't even have oxygen, let alone ventilators and critical care beds. But these countries have managed to keep both cases and deaths very, very low, despite not having these sophisticated facilities. And so it wasn't high tech, it was all low tech that worked. And the reverse is what's happening in high income countries, where there's everything, all resources, hospitals, the best doctors. And yet the public health infrastructure obviously has not been able to cope with the demands of this pandemic. So I think it exposes the weaknesses. We've seen where we need investments: primary healthcare, data systems, surveillance, risk communication, laboratory networks. Of course, you have to have a resilience in the human resource workforce, because the workforce got overwhelmed and everything else came to a standstill. And we are yet to find out how many people died of heart attacks and cancer and other diseases during this pandemic period. Those deaths from many countries, we don't know the excess deaths. And that's something WHO has been pushing countries to make sure that their essential health services are also up and running. So that really speaks to the resilience in the face of an emergency. The other big lesson for me is that you need global collaboration and solidarity at times like this. A pandemic is not something that can be handled country by country, agency by agency. It's only by all of us working together. And I've seen how that has paid off, at least on the science side that I lead, how we've brought together scientists, researchers, developers of drugs and vaccines, the private sector, civil society. We've brought them together under the platform of WHO, convened them, and advanced the knowledge that we've gained in this. And that's a unique convening role that we have, that we're able to get everyone to sit around the table, no politics, just talk science, and be able to advance the science together. And that's
how important that has been too. And WHO has been so good at making sure that message has been delivered loud and clear. And I think the communication has certainly been something that you put a lot of emphasis on. But there's been a lot of misinformation around and confusion in different countries from different, sources. What do you do in terms of helping to fight that miscommunication in many ways?
As you pointed out, in fact, we coined this term called infodemic very early on in this pandemic, because side by side with the virus, there was also this huge amount of information overload, I would say, on social media, on different platforms. A lot of it was credible, but a lot of it was misinformation as well, and rumors and theories and conspiracy theories. And so we started working with the tech companies, the big tech companies and the social media platforms very early on. And we've done several things. So we work with them in identifying, first of all, in providing credible sources of information, so that if somebody goes into Google and searches for information related to this virus or to the vaccine, they get the first things that come up on the Google search are credible sources, either government agencies, CDCs, or WHO, and so on. The second thing is that we flag to them. We have a team that's constantly monitoring social media, and we flag to them things which are false or misleading or untrue, or rumors, and they remove them. They actually remove them, or they put an alert on them. And I think that's actually made quite a big difference. And they've all actually given space to WHO to promote our messaging, and this has been across all of these tech companies. The other thing we've done is to bring together social scientists, a multidisciplinary group really from around the world, to think about infodemic and how to handle it. Because I think this is not the last time that we're going to be faced with this. We know that for vaccines, there's already a big anti-vax, unfortunately, movement around the world. And for the first time, you have people against a COVID vaccine even before one has been developed. And so I think communicating to people and really reassuring them, making sure we're listening to their concerns, answering their questions, needs a multidisciplinary approach, and behavioral and social scientists who understand how to communicate and what messages actually resonate with people and which don't. So we've taken this whole thing very seriously. It's been a new area of work for us, but I think it's been a very good learning experience, and hopefully it's had an impact.
And I think in many ways you've had to pivot and adjust and actually change your systems of communication, of how you work. And again, well done for being so proactive and engaging with the tech companies and everybody out there, because I think that message is getting across loud and clear. Now, we've had a few questions in, and one, just if we could quickly just point to it. Healthcare systems around the world are not created equally, and indeed many healthcare systems are perhaps underfunded in some areas. There's a lot to be done. This could be a whole other discussion. But a question that came in from Ibrahim Jamil, talking about an expensive, almost inaccessible healthcare system. What would you advise perhaps governments and healthcare providers and people, what can they do to help make this more accessible and probably affordable for everybody? Because everybody has to take action, as you say.
This is why WHO has been talking about universal health coverage, because well before the pandemic, because we know that without universal access to quality health services, a country's population cannot be healthy. And if they are not healthy, then you cannot have a vibrant economy. So health, I think, is really a driver of the economy. That message needs to go across, to people outside the health sector so that there's more investment into health. And so you need, of course, like I mentioned, good primary health care. I think that's the fundamental. Without primary health care, you cannot build a health system. No number of tertiary care hospitals and high-tech hospitals is going to make up for the absence of good primary health care, whatever the economy, high income or low income. Secondly, you need to pay attention to some of the drivers of poor health, the upstream, what we call sometimes the determinants, the social and environmental determinants of health, which are things like air pollution, which are things like safe water and sanitation, which are things like good diet and balanced diet and good nutrition, avoiding alcohol and tobacco, making sure that there's road safety so people are not dying in road accidents, and attention to mental health. These are some of the drivers of ill health, and people either die as a result of diseases that are caused by these risk factors, or they suffer chronic illnesses, cardiovascular, lung disease due to air pollution. 90% of people in the world today live in areas which do not meet the air quality standards of WHO. So there are some, and 40% of the world doesn't still have access to clean water, drinking water, and safe sanitation. Similarly, one could go on. There are many healthcare facilities in the world that do not have water and sanitation. So these are very urgent. Investments need to be made. Also looking at these, whether it's legislation in countries, whether it's policies, and these are all intersectoral actions that are needed. So again, health is not just a matter of the health system and hospitals, but it's really a matter of addressing all of these determinants that impact our health. Eventually, we have to start thinking holistically, and I think the SDGs are a good way to think about them because they're all interconnected. And I think UN Secretary General often likes to say that SDG 3 is the sort of the anchor really for all the other SDGs.
And indeed, you're so right. And our time is actually sadly up, but what a great discussion. You imparted a lot of knowledge there, but I think you really brought it down also to, which is so important, the fact that we as individuals can do a lot to look after our own health, to make sure that we're in a safe environment, and to taking preventive measures by almost using our common sense of behaving ourselves. And a lot of that sometimes doesn't tend to happen. But obviously the big focus for all of you and the great work that you're doing, and we wish you the very best to continue that work, because the world does need a solution and we all need to depend on the great work that you're doing. So we have to leave it there. But a big thanks to the Chief Scientist for the World Health Organization, Dr. Soumya. Thank you so much for taking this time to join us here on ABLF.
Thank you very much, Etna. It was a pleasure. Thank you.